Hello, everyone. My name is Dr. Pranay Gosh. I am an executive member of the IFS, the Indian Fertility Society, and currently I'm the program coordinator for this wonderful program that goes by the name of IEP, Intelligence Empowerment Program. And with us, we have the president of IFS, Dr. Pankaj Talwar, sir, my mentor and my constant guide. So, sir, before we start about talking about the IEP, the program itself, I would want to have your insights on how did you conceive of this program? आपके दिमाग में ये thought आई कैसे?
So, Pranay, thank you so much for this. Actually, being in the army, we already had a lot of constraints about information because we had very ordinary phones because we were working in high security environment. And later I realized that I think the most powerful weapon we have is intelligence. And not what lies here, but what lies beyond our mind. We call it something beyond human intelligence. So, as you know that we have got 9 types of intelligences. We think we are very smart. But when I ask people to write doctor in Hindi or to write sankalp in Hindi, they cannot write. So I say, okay, we are very cognitively advanced. So I say, okay, tell me a table of 9. The table they forget. So the amount of knowledge we have is probably more than thousands of such mobile phones. We get around 70,000 thoughts per day, in which around more than 80% are repetitive. So, and then the worst part in our specialty is that whatever we learn, it dies with us. So I thought, why don't we make a program and take help of some tools by which we pass on our knowledge to a virtual brain, and that is AI. And you know about the way you started it. So I think we were walking that day in one of those, there was a very nice winter evening when we were walking, winter afternoon, and we thought about, will you lead that because I'm goal in this. And you are very smart. You are like an artificial brain for me. And he said, I will do it. I think we've done a lot of work, and you brought a big change in the country's perspective. And thank you so much for doing this for me. But how did you do it? I only had some ideas in my mind, and I keep getting ideas. I don't sleep. When I was 10 years back, people told me कि बुढ़ापा आ गया है, अब सोते ही नहीं हो. पर अभी भी वही कहते हैं मेरे को लोग. But how did you ideate from ideation to execution? How did you do it? I think you faced a lot of resistance initially because not many people were supporting us. The thought was new, but you fought on, and that's Pranay, na? Pranay ने ठान लिया तो करके दिखा दिया.
Sir,
कैसे किया?
at the outset, I'd like to thank you for your confidence in me that I'd be able to do it, because if somebody was to ask me, would you be able to do it? I would at the outset refuse that it's not me, because it has been a constant learning experience for me as well. It's not something that comes to me naturally. ऐसा नहीं है कि ये कोई laboratory procedure है जो at the back of my mind मैं कभी भी कर सकता हूँ. It doesn't come automatically to me. So it has been a constant learning experience for me as well to shape each and every webinar. We had a lot of struggle. And a big part of the struggle was internal resistance as well, because getting on board people was the easy part. Am I doing justice to the audience? Am I doing justice to anybody who's spending the time in the webinar? That was a bigger question that I had to answer, because, you know, I'm not an expert in AI or ChatGPT or any of the GPTs. And it was a constant learning experience for me and my co-dignitaries who assisted us with the whole idea, and the experts as well. Some of the initial resistance was, the hurdles were that any of the experts that we brought on board, they could not connect with the audience. Because they were very specific in their niche, and they could not understand our struggles. So I think one of the reasons this program somewhat succeeded is that we decided to take it upon ourselves that we have to do it without the help of any experts, because we know what our struggles are. So I think it's a program for the clinician, by the clinician, and that's why it has succeeded. And how we went about executing it was, we basically wanted a very grounded philosophy that we are just going to keep it simple. We want that it be practical, no theory-based teaching, no rote memorization. It has to be accessible. We wanted to reach out to anybody who has access to mobile and internet. level 2, tier 3 cities, postgraduates, trainee embryologists, whosoever wanted had the urge to learn. And we wanted it to be repeatable in the sense that there is no उसका कोई point नहीं कि हमने कुछ सिखा दिया कुछ बता दिया और वो कोई दोबारा यूज़ ना करे. So we wanted it to be repeatable by the audience in a short matter of time with minimal hand holding. So that's how we identified our day-to-day pain points where we are struggling: automation of tasks, documentation, prescriptions, notes, OT notes, procedure notes. And that's how we started about. For each of the webinars, we pointed out a particular pain point, a particular problem. Then we looked at, is there a specific AI tool to address this problem? And we focused on that. So we started with the basics, the GPTs, the chat GPTs, and then we moved to AI-based presentation maker, AI-based video generator. And gradually we moved on. So I think we have succeeded somewhat with the execution part as well. And now we are at the consolidation phase at the end of this 2 years, where we have been able to touch upon the basics, the fundamentals of GPTs, prompt generation, prompt library recreation, automation of tasks, video generation, presentation generation, manuscript writing, and whatnot.
Super.
So it has been a learning experience.
Amazing job you have done. I had a dream to. I always felt that as a gynecologist, I think we're the most hardworking people in this world. Indian gynecologists. We spend around 80 hours per week working. So when people say that we should work for 70 hours a week, I wonder, how about gynecologists? We are spending more than 85, 90 hours in the labor rooms and wherever we are working. So I had a dream which you really fulfilled. Thank you so much for this. And I think we owe it to IFS for giving us this opportunity. The dream was to make life of a gynaec comfortable. I always felt that gynecs are the people, even embryologists like you or a clinician, that we work so hard, we don't have any time. So I'm a firm believer that we should spend what people do, that people spend a lot of time to get comfort or money. I always say that we have to spend money to save time. And for this, AI came to my mind and then you initiated it. And we have done a big project about training all the gynecologists. Gentlemen, ladies, IFS took an initiative to train all the gynecs of the country in ChatGPT. So ChatGPT is a generative tool. There are many of like that. There is Gemini, there are many tools like that. So we took up ChatGPT because ChatGPT was that time easily accessible. But now look at Gemini, and there are multiple other tools also available for generative AI. I think we've done a great job and we did many programs. So can you tell people, how did you implement this difficult task of training gynecs? Because gynecs, the moment I say, आप आइए तो कहते हैं हमें नहीं सीखना, हमें समझ में नहीं आता. They are all busy sitting in labor rooms and delivering. So I had a very nice experience when I think Dr. Neeru was also there in Gurgaon Society. I was talking about AI. So one girl told me, can AI do my delivery? Can AI do delivery for me in the labor room? I said, no, it can't. And then it's of no use. So how do you tackle such things? And how have you handled making this project so successful all over the country? I think the last program you did, you had around more than 300 people who were attending gynecs, that too on a Saturday morning. You have done around 7 to 8 programs before also, training all the gynecologists. How did you execute that difficult task?
Thank you, sir, for this question. And yes, in the last
and did you find them receptive? Sorry, did you find those people receptive? Because you were training them. I've seen you're taking them step by step to prompt generation, when you talk about prompts, what prompt? We are always prompting each other, ऐसे कुछ करते रहते. But prompt generation and making libraries, generating PPTs, generating pictures, talking about Delhi. How did you do it?
So initially we did face not resistance, I might say, but a lack of connect between us and the audience. And I think we were not looking at what the audience wanted out of us. So we changed our focus from delivering the primary outcome measures to some secondary outcome measures, not assisting in deliveries of procedures, but perhaps emptying up those 6 to 8 hours every week, which the time that can be dedicated to lab work, the clinical work, patient counseling, addressing patient grievances, grievance redressal, freeing up time for academia, research, and maybe attending a webinar like ours. So when we told,
Or maybe spending more time with, I always feel that they should spend more time with their husbands, time with their children. And
true,
I feel my agenda was that they should be able to do right projects for their children for summer holidays. They should be able to uh, help in making the list of grocery. So because ChatGPT is not only about technical information, it's about how to make our life comfortable. So this is a job I saw you doing, teaching people how to, talking about how to book a cab or how to do grocery shopping and how to help their children grow. So I think it's a great thing you have created. So yeah, sorry I intervened here because the topic is so dear to my heart. I can't stop myself from talking. Over to you.
I was really delighted to see that the audience participation in the last webinar was exemplary, over 200 plus,
Yeah.
and the audience was so receptive, and we were learning so much from them
And
that
they were all gynecs, I believe.
they were almost all gynecologists,
gynecs, yeah.
and they were sharing the hurdles now that they are facing with the use of ChatGPT. It is not getting them on board, but they're already on board, and now they tell us that they are using this for social media creation, for creation of pamphlets or things that eventually they end up doing on a day-to-day basis. So we were so happy to see that a naive audience at the start of the first webinar who had no idea about ChatGPT coming back to us.
Which was when was your first webinar, Pranay?
It was
Approximately. I mean, I know it's you do so much of work, but how long back did you do your first webinar? How many months or years back?
It was April 2024, last year at the inception of this term of.
अब फिर तो रुका नहीं उसके बाद फिर प्रणय रुका ही नहीं
We did fizzle out, and I have to acknowledge Dr. Talwar again here that due to our internal resistance and the obstacles that we faced, we at times perhaps gave up, but you constantly prodded us and you told us that this is a fruitful project which is going to perhaps benefit you the most rather than the audience. And that was my internal motive to keep going at it. And I am really thankful to my co-collaborators, Dr. Doyle in the first year and Dr.
super.
Divya this year, who is a precision medicine specialist. And we had so much to learn from her. And the engagement that she has gotten over the last 4 or 5 webinars is immense. And I again have to acknowledge them. So,
I think the women's spa.
True.
Women are there everywhere. When I met Divya and I met Deol, I mean both are from D's. So all the girls with name starting with D are very good in AI. I was quite shocked to when Divya told me she is doing Python programming because when she had gone to Singapore, she had gone to learn precision medicine. I told her to take precision medicine for training. But now she's becoming a Python programmer. So the Python programming is the most important tool in generative AI. So I think super. आपको लगता है कि आपने कुछ दिलों को, कुछ दिमाग को छुआ कि एक जर्नी पूरी कर दी?
sir, though the program is primarily meant for our fraternity, I think we have been able to step beyond the fraternity in helping the patients directly, in the sense that
Yes.
the time that we have freed up for the physicians, the clinicians, that they are able to dedicate to their patients in the patient care, like I mentioned, counseling, grievance redressal, or the use of AI for bringing some concepts to fruition, like creating pamphlets and posters in local language for raising social awareness. So we have been able to indirectly reach out to the community directly, but direct connect to the fraternity remains. We have been able to penetrate the tier 2, tier 3 cities, the postgraduates, trainee embryologists, and anybody who's had the will to join the webinar. So we have kind of democratized the knowledge. We have not kept the knowledge to the select few who could only pay for the AI courses that are so expensive nowadays. Anybody who has the will and the access to internet has the access to our programs. And I think it is very important for nation buildings that you decentralize and democratize the knowledge, so that the knowledge is not in the hands of select few and you have everybody has equitable access to knowledge.
Super. So when I go back to the past, because you go back by a century or so, now when I'm touching 60, it doesn't look very big. Go back by a few hundred years, the knowledge was doubling every 100 years. but now medical knowledge is doubling at a very fast pace. And I think the last numbers I have is around 74, 75 days. The whole of medical knowledge doubles up in around 3 to 4 months. And I think it's a very good tool to keep abreast of the knowledge. What do you feel would be the future of this program in IFS, and how do you want to take it forward in the coming few years?
So I think this program has sown the seeds of empowerment in the sense that we are adapting to the changing world. But now we need to move from adaptation to innovation in the sense that once our new, younger clinicians and embryologists are comfortable having adopted this technology, now they have to move from adoption to innovation in the sense that we don't get left behind and we are not just mimicking the West. We are having our own ideas being brought to fruition. And for that, I think has been a wonderful start. And I think the way forward is that we become more digitally literate, scientifically more reliant, so that we are able to draw our own nation-specific, area-specific guidelines and good practice points. And we don't have to look to the West to mimic what they're doing and not have any novel thoughts or innovations. So I think this program gives a lot of confidence and builds a future-ready task force so that they are self-reliant, confident that they have been abreast with the knowledge from the day zero, and they are ready for anything that the world, the real world or the academic world throws at them.
Super. So do you believe in chatbots?
I do, sir. It has been an
Do you have a
immensely
chatbot
helpful.
with you? Have you tamed a chatbot or not?
Not yet, sir.
Not yet. Do you think, Pranay, in coming few days, we're going to replace our EAs with AI engineers or AI executives?
Sir, I think we should not forget the heart of this program, which is to embrace AI and simultaneously not lose out on the human touch, the empathy that. So I feel that AI will never be able to replace the human touch.
Human touch, okay.
And I think that's what our patients also want from us. They don't want to be just another face, just another UHID, just another number. And I think that's why the legacy-based clinics still are very sought after as compared to. But again, that's a debatable
So
topic.
we had a lovely baby taking birth in, I think, Mexico, where all the steps of IVF are done by AI. You're aware of that. So I think we've come a long way, and I'm very, very sure that IFS, all the programs are safe under your mentorship, and I wish you all the best. And any last message for the audience, Pranay?
Sir, my message would again be very simple. I want everybody who's watching the program to stay curious, stay foolish,
Stay hungry,
stay hungry, stay foolish,
Lovely,
and
lovely.
embrace any new ideas that come to them, either AI or anything else, and be ready for a world that will be very different from today, so that we are not.
In how many years?
It's changing as we speak, sir. It's changing as we speak. Our webinar that we've had 3 months ago is almost obsolete in terms of the information that we are imparting to the delegates, and we have had to redo it in the last webinar. That the information that was given to you regarding ChatGPT, the pricing, the models available in India, it's no longer the same.
No longer there. So I think great having with you us today, Pranay. And I think the message will be that in case we don't adapt and adopt, we'll be like a dinosaur. So thank you so much, Pranay. I really enjoyed talking to you and wish you all the best.
Again, my pleasure, sir.
Thank you.
Thank you for everything.